Hi, I'm Dr. Johanna Tessman. I'm a psychologist at the Capital Area Intermediate Unit, and this is my colleague, Jennifer Yingling, who is a special education expert who's going to be speaking today along with me about issues related to autism. We're going to start by just talking about the autism assessment experience, a typical autism assessment that families might go through if they were to come to our intermediate unit, but it's very similar to what one might experience in another setting in terms of who is participating and what kind of issues are being looked at. So Jen's going to talk about that. And then I'm going to talk about the diagnostic criterion related to autism. And then Jen's going to close for us today talking about resources that are available for families with children with autism. And then also we will, she'll give you kind of a short list of potential avenues for autism assessments. So I'm going to hand things over to Jen. She's just going to talk a little bit about the process of the autism assessment.
Okay, so when you come to RIU, you can plan on coming for 2 or 3 hours. Depending on how our children respond, it can take a little bit longer, it can take less time. And what happens when you're with us is 2 things. The first being a parent interview. So our families sit down with a service coordinator who goes through developmental history, what kinds of things families are seeing at home with their kiddo, and then the team evaluates the child. So in terms of the parent interview, what you can do is part of that interview is bring any assessments that you have from outside agencies, or if there are any therapists working with your child, you can bring information from those providers. We can use that as part of our evaluation, and we encourage you to bring that. And then the other thing to happen is that your child will be evaluated. So we have an evaluation team who spends time with your child collecting information using standardized assessments and observation of play and social interactions with the team. So a school psychologist might be on the team to do some testing with thinking and learning, and also some questionnaires or structured assessments strictly regarding autism. A speech therapist may be part of the team to look at all areas of language, which includes understanding of language and speaking and using language in a social way, which is important. And then an occupational therapist could be on the team to look at large and small muscle movements, sitting still, paying attention, participating in adult activities. So those 2 things will happen. Then after the team is done collecting information, we'll leave our families in the room, and we go across the hall. And what we really do there is score any testing and share information that the parents have brought along with them. So we come back to our families after about 15 or 20 minutes, and then we share all that information verbally that was collected through the evaluation process. So we chat with our families about the testing, about the observations, and we talk about what services your child qualifies for, in addition to talking about diagnosing autism if it is or is not appropriate at that time. So then what we would do is talk about the criteria. So I'm going to pass back to Dr. Tessman, who will share information related to what qualifies a child for a diagnosis of autism.
Children, in making a diagnosis of autism, we typically are always thinking in the back of our minds about the diagnostic criterion. The diagnostic criterion can be found in a manual called the DSM-5, which is the diagnostic manual that's used by psychiatrists and psychologists in order to make book was updated in 2013. Prior to 2013, we had subcategories like Asperger's and pervasive developmental disorder and Rett syndrome, and it was decided that with the exception of Rett syndrome, that autism really was a spectrum disorder, and that rather than breaking it into Asperger's, which was considered to be high functioning autism and was found to be very redundant with that, that we would give a diagnosis of autism and we would label degrees of severity. So the DSM has one general category of autism, and then we can talk about autism as being higher or lower, although in the education system, we just say a child has autism. But we certainly talk to families about where children are in terms of their learning and how that impacts autism and autism functioning and so forth. So we look in all children with autism for these two main diagnostic criteria. One is children having social communication disorders. So children with autism typically have difficulties having reciprocal interactions, back and forth interactions with both adults and children. Although a lot of times with younger children, we see it more in the interactions with children than we do with adults. Although sometimes we'll just see a broad-based general language delay. But what we look for is just that easy back and forth flow that people with typical language have, in which dialogue always. So that's the first thing we look at. We look at social pragmatic language, language that's used in a social way to request, to discuss, to initiate and sustain interactions. Those things we're always looking for. That's a really important component in autism. Then we look specifically at nonverbal communication. And what we know is that children who have overall language delays but not autism develop a series of ways of communicating with others that are nonverbal. They use gestures, non-verbal gestures like be quiet or come here. Children with autism don't typically use those. They also, children who have language delays but not autism, have changes in their facial expression of emotion. So if they're excited about something, they're going to have a facial expression that goes with it. Children with autism don't change their faces very much at all. So that's something that we are always looking at. That's why it's important that a speech therapist typically be a part of the autism diagnostic team, because they're looking very specifically at what nonverbal gestures are present in comparison to how old the child is. And they are looking very closely at, as are all members of the team, is this a child with just a generalized language delay, or is this a child with autism? And looking at nonverbal gestures is an important way of looking at that issue. Thirdly, we look at children's abilities to understand that there's another person in the world. And our young children with autism, because they have difficulties in play interactions with other children. They often have delayed play skills, and we'll talk about that in a minute. They might have fixated play skills, so only play certain games or play with certain toys, but they also often have difficulty in initiating, sustaining verbal interactions. So that's where we might see the difficulties in doing that back and forth piece. So that's something we look at a lot. We also look at level of play. Is there level of play? They might have, children may have very, their letters, they know their numbers, but when they sit down to play with somebody, a 4-year-old might not understand the concept of back and forth play. They might not have imaginative play yet. So we look and see very closely where their play skills are. So that's one thing that we look at a lot when we're doing that observation that Jen was referring to. Then the other thing that we look at, in addition to the delays in social communication, is restrictive, repetitive patterns of behaviors. One thing we look for are, and that we see in children with autism a lot, but is not only seen in children with autism, are things like what are called stereopathies, which are flapping hands when you're excited, jumping up and down, having particular behaviors, posturing with your fingers. Those kinds of things are considered to be a repetitive pattern of behavior. And so that's one of the diagnostic criteria for autism. Secondly, we look a lot at the issue of rigidity. And those people who have children with autism will be nodding now, because they will understand that they know and live that children with autism can be very rigid. They can be rigid about what they eat and what they wear, what they play with, where their moms drive when they're going to the grocery store. If it becomes a different path one day, that could be a problem for a child. So we look at that rigidity, the lack of flexibility. And what we see in a lot of children with autism is they're very reactive if that rigidity is violated. If something different than what is different than what they play with, because they only like to play with things about the solar system. If they're offered, cars and trucks, then they could get very upset. So rigidity is a really important diagnostic criteria of autism, and something that we as therapists work on a great deal, because that can really be problematic over the lifespan of children who have an autism diagnosis. So like I said, we look for highly restricted fixated interests. So like I said, Jen and I have seen children who are fixated on only the weather, only the solar system. We might see a child who's they'll only play with whatever the latest Disney movie is. That's their only area of interest. All their toys are that. We see a lot of kids who love trains and only want to play Thomas trains and nothing else. So that's something we see a lot, and that's something that kind of makes us be concerned, and we consider that one of those things called a red flag for autism. And then in terms, finally, of the rigidity, we look for children being hyper or hypo-responsive to things. And what we see probably more commonly is children who are hyper-responsive to things, so that they only prefer particular textures in foods. They only will wear particular clothing, for example, clothing that's soft, socks that don't have lines on them. They won't wear clothing that has tags. That can be a big issue. They are hyper responsive to sound. So if the vacuum cleaner is run, or they won't use a public toilet because the public toilet is too loud and upsetting. If a fire truck happens to go by, that can be very disorganizing for a long period of time. And then sometimes we see kids who are not responsive to certain things, and that worries us too. So they might not feel pain. They might run into a door and just nothing happens, or they might have an ear infection, but you don't know that until you get to the pediatrician with a child who has a high fever, and then they look at their ears and like, oh gosh, they have an ear infection, and the child hasn't been telling you that their ears hurt. So that's something we look for a lot too. We look for those differential patterns of responsivity. So the other diagnostic issues related to autism is that you're born with autism. You don't develop it over time. It's a genetically based disorder. So we look for the features of autism being solidly present by the time children are 24 to 30 months. And we say that a diagnosis of autism is really considered to be stable at about 30 months. That if a child looks and feels like a child with autism at 30 months, they're probably going to have a diagnosis of autism over the lifespan and have some, maybe very few, or maybe a lot of these symptoms I've talked about over their lifespan. And we look for these issues being present in more than one setting, always. So we want a child who's showing these limitations in their childcare setting, in their home, when they go to grandma's, multiple settings. And thirdly, while children with autism can have intellectual disabilities, an intellectual disability sometimes can explain all these symptoms in some children. So a child could have an intellectual disability and not be autistic, or a child could have ADHD and not be autistic, or they could have autism and ADHD. So we look at the combination of possible things that can go along with autism and make sure that's not the only thing that's going on. The other thing is the incidence of autism at this point is thought of being 3 boys to 1 girl. starting to think about that a little differently because girls who have autism present a little differently. They tend to look a little bit more social. So we're starting to wonder if really maybe girls are underdiagnosed, but in general, autism is a genetically based disorder. So we are concerned if there's a father with autism or a sibling with autism or a cousin with autism, we look for that. We also would be more concerned about a boy than a girl, at least based on the information that we know now. We also know, along with the genetic loading, that autism can go along with particular genetic patterns like Fragile X. That's a very common correlate to autism. So if a child has a Fragile X diagnosis, they typically are taken for an autism diagnosis to have that rolled out as well. So Jen, anything else that we need to add at that point, or do you think we kind of covered the diagnosis?
No, I think that covers it.
So then what we want to do is go on from that to think about, Jen's going to talk now about if a child is diagnosed with autism, what kind of resources would be available for a child with autism in order to address those deficits that we talked about. Encourage the strengths, address the deficits. So I'm going to turn things back to Jen so she can talk about resources for children with autism.
So if your child gets a diagnosis of autism, the intermediate unit will provide the specialized educational services that your kiddo needs to work on those needs that have been identified, and also, like Dr. Tessman said, draw on those strengths as well. The first thing that you need to do is apply for a medical assistance card. Even if your child has private health insurance with one of your employers, you need that medical assistance card that you can think of as a golden ticket to access services that are available in the community to help your child in the community and at home. That application is available at compass.state.pa.us.
Could you spell Compass for the families?
Absolutely. It's compass.state.pa.us. That's a good point. So after you get the medical assistance card, you can start looking, before you get the card, you can start looking into additional services that the IU doesn't provide, like behavioral health services, which can be supportive at home or community-based, in a child care setting. And also, you can think about applied behavior analysis. Known as ABA, it's a behaviorally based program that has been shown to have great benefits for kiddos with autism. And there's a website that families can access for more information on ABA and for information about providers. And that's abainpa.com. After you access supports at your local intermediate unit, you can also chat with your family pediatrician about any community services that they think would be helpful for your kiddo, including a referral for a developmental pediatrician, which would be helped to look at any, overall developmental medical concerns. So if you have concerns about autism and you'd like to pursue a developmental evaluation with a physician, there are local resources like the Children's Hospital of Philadelphia, DuPont, which is in Delaware, Penn State Hershey, Geisinger, Pittsburgh Children's, Hopkins in Maryland. Any developmental evaluation would begin with a conversation with your physician, because you would need to utilize private insurance for that, so they can be a good resource to help you out to get started with that. Anything else I missed in terms of community resources?
No, I thought that was fantastic.
Okay.
I think if families would like a kind of general overview about autism and more information, certainly they can access just the DSM diagnostic criterion that I was talking about online. You would just put in DSM-5 and autism, and those diagnostic criterion would come up. But a more general overview can be found in a really lovely, inexpensive book that's available on your local Amazon, produced by the American Academy of Pediatrics. It's called Autism Spectrum Disorder, What Every Parent Needs to Know. And that that would be another great place to look.
Instead of just inputting Google.
Yes, don't just input Google. That's what we're gonna leave you with. Don't just input Google if you're looking for information about autism. Try to stick to some of the sources that we talked about, like calling, your developmental pediatrician, or looking at this book, or looking at the DSM criterion, or contacting your local intermediate unit. All of those places are gonna give you more informed information than going on the Google. So thanks so much for listening to us today, and we hope you learned something about autism, if that was helpful to you, and we'll say goodbye.
Have a great day.